Ani Bojo Wikumkong, Cody Wassengeso Dishnakas. Good day, Wikumkong. It's Cody Wassengeso here from Naandwechige-Gamig Clinic again to do our weekly message. So today's weekly message is in regards to just getting prepared for students going back to school. Just to be aware, because we're going to be going into kind of new territory here with the type of schedules that are going to be implemented. So with a lot of change, you'll probably notice will become a lot of anxiety for our young community members. So I just want to kind of give you guys kind of an idea of what to possibly look for if you think your child is displaying some anxiety. So more so for our elementary school community members, you might notice for them what their anxiety might look like is they might be complaining of tummy aches or stomach aches. You might notice that they're going to the washroom more often. You might notice that they can't sit still. They're always worrying about something happening. Might notice they're a little more irritable, or having trouble dealing with their emotions. Some other things to look forward to is maybe they're having trouble sleeping, or they're sleeping too much. They could also be eating not a lot or eating too much. So those are kind of some symptoms to look for if you think your child is having anxiety. And because with them, our younger community members, they're not going to be able to say, "Oh, I have anxiety," or "Oh, I'm nervous." They're not going to know that. They're going to attribute it to something else. So these are more of the typical signs to look forward or look for with the younger people, is that they'll describe those type of things, kind of like I said, the stomach aches, the can't sleeping, the worrying constantly, can't sit still, the outbursts. Those are kind of the things to look for. That's more could be attributed to anxiety. There are more types of symptoms as well, but everybody's different. But those are kind of the common ones to look forward to. And then for just our older community members, they'll have a bit of a better understanding of what the anxiety might be. But again, just listen to them and understand them and kind of hear them out. So with that being said, just don't be afraid to always ask your child how their day went and stuff like that. Always check in with them just to make sure. And if you feel like they are having anxiety, don't be afraid to reach out for the proper supports that are out there. So with that being said, that's kind of today's message, and just to help you guys be more aware. So with that being said, I'll talk to you guys next week. Bye,